Welcome to this video about cardiac hemangioma, a rare and often overlooked condition affecting the heart. Join us as we delve into the causes, symptoms, diagnosis, and treatment of this unusual cardiac tumor. The exact cause of cardiac hemangiomas remains largely unknown, making it challenging to pinpoint specific risk factors. Most cases are believed to be congenital, meaning individuals are born with them. Genetic mutations may play a role in some instances, but further research is needed to establish a definitive link. In rare cases, they might arise spontaneously without a clear underlying cause. Cardiac hemangiomas are benign tumors composed of abnormal blood vessels that form within the heart tissue. These tangled masses of blood vessels can disrupt the normal flow of blood through the heart. Their size and location dictate the extent of the disruption. As they grow, they may compress surrounding heart structures, potentially leading to arrhythmias, heart failure, or even sudden cardiac death. The specific mechanisms behind these complications vary depending on the tumor's characteristics and its impact on the heart's electrical and mechanical functions. Cardiac hemangiomas are exceedingly rare, representing a tiny fraction of all cardiac tumors. Due to their rarity and often subtle presentation, the precise incidence and prevalence are difficult to determine. They can occur at any age but are more commonly diagnosed in infants and young adults. They do not appear to have a significant predilection for a specific sex or race, occurring relatively equally across populations. The signs and symptoms of cardiac hemangiomas vary considerably depending on their size, location, and rate of growth. Some individuals may be completely asymptomatic, with the tumor discovered incidentally during imaging for other conditions. Others may experience a range of symptoms, including chest pain or discomfort, shortness of breath, palpitations or irregular heartbeats, fatigue, and swelling in the legs or ankles. In severe cases, cardiac hemangiomas can lead to life-threatening complications such as heart failure or sudden cardiac arrest. Diagnosing cardiac hemangiomas requires a combination of imaging techniques. Echocardiography, which uses sound waves to create images of the heart, is often the initial diagnostic tool. Cardiac MRI, with its superior soft tissue resolution, is crucial for confirming the diagnosis, assessing the tumor size, location, and extent, and distinguishing it from other cardiac masses. Computed tomography or CT scans may also be used. In some cases, a biopsy of the tumor may be necessary to confirm the diagnosis and rule out other conditions, although this is less common due to the risks associated with cardiac procedures. Cardiac hemangiomas are generally classified based on their location within the heart, such as atrial, ventricular, or pericardial. They can also be classified based on their histological appearance, with capillary hemangiomas, cavernous hemangiomas, and arteriovenous hemangiomas being the most common types. Capillary hemangiomas consist of small, tightly packed capillaries, while cavernous hemangiomas are characterized by larger, dilated blood vessels. Arteriovenous hemangiomas involve abnormal connections between arteries and veins. The classification doesn't dramatically alter treatment, but it aids in understanding the tumor's characteristics. Treatment for cardiac hemangiomas depends on the size, location, and symptoms of the tumor, as well as the patient's overall health. Asymptomatic, small tumors may be monitored with regular imaging to assess for growth or changes. Symptomatic tumors typically require intervention. Surgical resection or removal of the tumor is often the preferred treatment option when feasible. Minimally invasive surgical techniques may be used in some cases. For tumors that are difficult to access surgically, other treatment options such as embolization, which involves blocking the blood vessels supplying the tumor, or radiation therapy may be considered. Medications, such as beta blockers or antiarrhythmics, may be prescribed to manage symptoms such as arrhythmias or heart failure. Because the cause of cardiac hemangiomas is largely unknown, there are currently no specific preventive measures. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, is always recommended for overall cardiovascular health. However, these measures are not specifically targeted at preventing cardiac hemangiomas. The prognosis for individuals with cardiac hemangiomas varies depending on the tumor's characteristics and the effectiveness of treatment. Small, asymptomatic tumors that are discovered incidentally often have a good prognosis with monitoring alone. Symptomatic tumors that are successfully treated with surgery or other interventions also tend to have a favorable prognosis. However, larger tumors or those located in critical areas of the heart may carry a higher risk of complications. Recent research is focused on improving diagnostic techniques, developing less invasive treatment options, and identifying potential genetic factors that may contribute to the development of cardiac hemangiomas.